Dr. Vu, tell me what the easiest medical field is.
Okay, let's start again. Here we go. 3, 2, 1. What do you think is the easiest field?
Hi guys, it's Dr. Sue here. In my opinion, every field has its difficulties, and there are ways of making things easier depending on your own circumstances. But if I was to choose a specific field that I felt was easier, I'd say in terms of how you can work, the way you can work, it would be radiology. And I think that's because you could probably do some of that work from home. And if you like working from home, then that might be the area for you.
But isn't that the one field that could be taken over by AI?
Good point. I'm not sure, but I don't think we're there yet. I know that AI technology is being used, obviously, even right now. So I know that AI technology is currently being used to assess lots of various different scans, but we're not at the point where it's taken over completely. And I don't know how fast this technology is developing at the moment, but I would say yes, that might be a risk. However, I also feel that AI is something that we can't shy away from, and I feel that every specialty will have some form of AI involvement at some point, depending on how the technology develops in the near future.
So how about this? What's the hardest field of medicine?
I think that's an even harder question, and the reason why I feel that is because there are some specialties that maybe in theory might seem slightly easier in the sense that the hours might be shorter, or the patient group that you have, they might have specific conditions, and you'll be concentrating on certain things. But the reason why I feel that's a harder question is because it depends what you mean by hard. Is it that some specialties are hard because the patients that you see have really complex diseases, complex medical problems, and you might need to be dealing with all of those complexities. But there are other specialties that you might feel that are harder, where you spend hours in theatres. For example, if you work as a surgeon, surgery is a specialty that takes a long time to train in, but also even at a later stage in your career, you'll be in theatres for long hours. So that is difficult in the sense that obviously you're going to have long hours in theatre where you're performing an operation. But I feel that there are certain specialties like palliative care, which I feel is quite hard because you are dealing with end of life, you're dealing with dying patients and their families. So really, I don't think there's a clear or easy answer to that question. And I feel that, it depends on what you feel might be hard. And, for some people, primary care is hard. A lot of people feel that that's an easier specialty. I don't necessarily agree with that, because I feel that yes, the training might be slightly shorter, but it is a specialty where you need to know a little bit about everything, and you need to be able to assess your patients holistically and deal with one problem at a time, I guess, in the short and limited time that you have in primary care.
Excellent, thank you. So one last question. What's the coolest area of medicine?
Of course, I might be a bit biased, but I'm going to go with, for me, I like primary care, but I also...
So that's family medicine in America.
Yeah, that's it. That's family medicine. But the reason why I like family medicine is because you see, like I said earlier, you see a bit of everything. So you're going to see people presenting to you with all kinds of things. Yes, you might not be able to manage all of those problems within primary care, but you are the key person to direct your patients to the right specialty. But also there are certain things that you'll be able to do before you do that.
That's excellent. Thank you so much, Dr. Sue.